Good morning. Welcome to this edition of the Lynne Hayes Freeland Show. Who knew when we went into this social distancing mode that I would still be doing my show at home months later? And who knew that in a lot of ways this story would change? So social distancing is still an issue. The COVID-19 virus still an issue. But now, on top of all that, we've got protests. We've got the story of George. Oh, boy, I'll tell you what, I just didn't even know that everything that happened in Minneapolis was going to change our focus, change our direction, but it's still intertwined because when we talk about Black and brown people, once again, we're at the forefront of the story. So how does that all fit in together? Well, you're going to be surprised at what we have to talk about today. Two individuals, two perspectives that are going to put this story in some kind of pocket for us. Dr. Chantal Villalobos is a family resident physician. She's also a part of the executive committee at Gateway Medical Society. Welcome to the show. And Kiana Williams-Pate is a public health practitioner. Would that be a best way? Practitioner, public health?
Professional.
Professional. She's at some point, she's probably going to decide to be a physician, but our health is her priority. Welcome to you both.
Thank you for having us.
Thank you for being a part of this show. Dr. Villalobos, let me talk to you first. Let me start with you first, because one of the reasons why I wanted to have this conversation today was because all of a sudden, we are protesting. We are seeing protests everywhere. We're seeing young people out in the street. And it's started a whole new conversation because some people are protesting with masks, some are not. But certainly the protests are way more than 10 people, 25 people, hundreds of people. Does that concern you from a health perspective?
Well, from a health perspective, 100%. And from a human rights perspective, even more so. So I think the issue at hand, so many of us can agree, injustice and inequality and all the racial disparity that we have been feeling for centuries are just really taking a toll on all of us. And it's flaring up so many emotions. And it's really important that we start to really share our voices and be out there. But amongst these pandemics that we're having, it's important. It's a big health concern. And so one of the things that I'm really concerned about is that we are starting to see control of the coronavirus COVID-19. And as protests are now occurring, you're going to see a breakout and potentially second wave of the COVID earlier than we expected, which was this fall. And we want to be safe. And I will say first and foremost, as passionate as we are about our community and standing up for the rights of folks that has been needing to be talked about, so much so, we need to think about how we're impacting our own communities. We are going to hurt ourselves and our communities and our health if we're out there protesting and spreading the virus. And so I actually had some points to share. If you are going to protest, please try to find safe and respectful ways to social distance, wearing your mask, being as safe as possible, but being able to voice yourself. It's not necessarily proven in data, but if you're going to be outside for multiple hours and protesting, yelling, chanting, you're going to soil your mask and it's going to build up. And so something you can think about is taking multiple masks with you. I can't tell you exactly after 2 hours of counting or 4 hours, but I would say take multiple masks. If you have the cloth ones, that's fine, and you put them away to wash later, but in a Ziploc baggie, take those multiple masks. If you're out there for so many hours, change it. Wash your hands often, bring sanitizer with you. It's important to still keep your distance. You can be united, and imagine the impact that you can have if you were to spread out 6 feet apart over blocks. And so I'm saying you can get smart about this and find a way and be peaceful about it as well, but yet be safe to our own communities, because that's who we're impacting. Another thing that I wanted to mention is that we are seeing people becoming COVID positive after protests. Something that's really important to keep in mind is that it's still very much so a real virus, and that the protests are actually the centers for the coronavirus to spread. We call them like super spreader events, where you have a high risk of spreading the disease and spreading the virus because of the mass of people, even with masks, because of the shouting, the talking, the yelling, the close proximity. You have respiratory droplets still flying around. So it is a huge concern. And yes, as a healthcare provider and as a human and as someone here in the US caring about my communities, it's a huge concern.
And Kiana, let me ask you, because I think that, a lot of these protests, while they definitely cover a wide variety of age ranges, they're going to be more likely in your age range than they're going to be in my age range. And give me an idea. I mean, is it something, do you think that people even think about it, or is it more the focus, I want to go out there and be heard, more so than thinking, maybe I shouldn't?
Well, I think coming from a young perspective that people are aware of, COVID-19 being a risk factor. However, it's also a matter of, fighting for social justice and our rights. So a lot of people are going out there to protest because they find that it's very important for them. But I think in this instance, some people may be forgetting, that we're still in the midst of a pandemic, because our emotions are very strong right now, given what's happening in our country. So sometimes that can be overlooked, that we're still in the midst of a pandemic, especially with things opening up more. It can sometimes get into hindsight and we're not really thinking about that as consciously. However, it is important to still be aware, even though we're young and we may not have as many symptoms as people who are older, that we can still carry the virus and we can bring that home to our families, to our grandparents, to our children. People who have diabetes and asthma are very high risk for this disease. And young people like myself, we may be carrying something like that if we're going out in high exposure areas and high contact situations, and we can bring that home to our loved ones. So it's very important for us to think about when we're going out and protesting, which is very courageous, to be mindful of social distancing and making sure that we're wearing our masks. And if we're going to be out there being exposed, to make sure that we're going to quarantine ourselves for 14 days away from family and loved ones, so that we don't bring it home to people who are at very high risk for this disease.
So wait, so after the protest, I should be quarantining afterwards?
Yeah, so something to think about is if you are going to make that decision and make that judgment, think about quarantining yourself, because the incubation time.
Wait. Do me a favor, hold that thought. We're going to take a commercial break. Because the other thing I want to talk about is this Club Rona. And I know folks are not quarantining after they're coming from Club Rona. So I see this is all connected. We'll talk about that in just a minute when the Lynne Hayes Freeland Show continues. So don't go away.